Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about an important topic which is called as diet after a gastrectomy in cancer patients. First, let us try and understand as to what is gastrectomy. Gastrectomy is a surgical procedure which is carried out in the patients who have gastric cancer or stomach cancer, wherein a part or the entire stomach is removed. The the surgery will depend upon the type of surgery will depend upon the extent of the disease, wherein either a portion of the stomach, which is partial gastrectomy, or the entire stomach, which is also known as total gastrectomy, can be performed by the surgical oncologist. Now, these surgical procedures can surely disrupt the normal GI anatomy of the patient, and they can also cause physiological functioning, can affect the nutrient absorption, and this can lead to various GI symptoms. Patients after a gastrectomy who have gastric cancer are at a risk of malnutrition, and poor nutritional status can negatively have an impact on their quality of life. Now, after surgery, patients will tend to experience various symptoms like lack of appetite, nausea or vomiting, feeling of fullness, which can also have an impact on their overall nutrient intake as well. Now, other symptoms which they may experience are abdominal pain, diarrhea, or even they can suffer from dysphagia, which means difficulty in swallowing. Severe symptoms which occur can also cause further psychological stress and can negatively impact the patient's food intake as well. Emotional distress, cancer related inflammation, or the symptom disturbance itself can also lead to an increase in the protein energy wasting, which leads to the reduced body weight. After gastrectomy, most of the patients have an insufficient protein and a calorie intake as well, and they continue to experience a weight loss of 6 months. Now let us try and understand that before going into surgery, what is the role of the stomach. So before surgery, the stomach is able to participate in the digestion and the absorption of the nutrients and the food efficiently. It will also control the release of the food into the intestine. However, after a gastrectomy is done, the role of the stomach will extremely change. It can only hold small quantities of food, cannot hold large quantities of food, and it cannot digest or absorb the nutrients efficiently as it used to before. Okay, so now what are the common side effects or the symptoms which can occur after a gastrectomy, and how to deal with this? So first is our weight loss. Okay. Now, after a surgery, even after a major surgery, our calorie and our protein needs are higher, right? They double because these are going to help us to heal as well. But our body is not able to absorb each and everything which we generally tend to eat. And we also feel full quickly as well. So, weight loss is expected after a gastrectomy due to these various reasons as well. Okay. Now, weight loss will also include both loss of the fat tissue and the muscle mass as well. Next is early satiety. It also means the feeling of fullness quickly. Okay, so now what we will do is after a gastrectomy procedure, the stomach size is basically reduced. right? So we are not able to eat large quantities of food at a time. Even if we have a few bites of food, we will be like, okay, I'm feeling full, I am not able to eat. So this is one of the major challenges also which is faced. So as the body will adapt after the surgery, the patient can increase the portion sizes to child size meals, and this will usually take 6 to 12 months after a surgery. Loss of appetite is also known as anorexia. After gastrectomy, our body is not able to have the signals to tell you to eat, and therefore we may feel that okay, we don't want to eat. But how do we overcome this issue? So, first of all, what you need to do is we need to prepare a schedule of when to eat rather than waiting until your body is hungry and you're starving. Keep small reminders or an alarm which is going to tell you that okay, at this time I need to eat my food throughout the day. Now, if you find it hard to eat when you do not feel hungry, okay, so what you can do is you can eat a large meal when you are hungry. Okay, now in between you can have unsweetened protein drinks. Ensure not to add sugar to that or any other sweetened enhancer because it can cause a gastric discomfort. After surgery, there are times when we might feel nauseated and we do not then feel to eat the food. So, when you feel nauseated, eat small amounts of the food. Ensure to eat slowly and to chew your food slowly before you actually swallow the food. Okay. Now, if you feel nauseous just before eating, choose something which is light or a cold food which can be easily tolerated. Try and avoid strong food smells, especially hot foods, which can again trigger a nauseated feeling also. Constipation is a major problem which is seen in these patients. It can occur if you do not drink enough of fluids in your diet. But if you are going to drink lots of fluids after a surgery, then you might also feel that okay, I'm feeling full and I don't want to eat my food. So then when do we drink the fluids? You need to have sips of fluids in between your meals rather than along with your meals, because already the stomach size is reduced, and if you are going to eat the if you are going to have fluids with your meals, you will rather feel full by having fluids than actually having your meal which is there. Okay, talk to your doctor to see how much is the water intake which is needed as well. Now, next is acid reflux. Acid reflux again can occur when you undergo a surgery as well. So, when I speak about acid, it means that the food, the contents of the stomach are going to backflow into the esophagus. But over here, we see that there is a bile reflux. Now, without your stomach, yes, you cannot produce stomach acid. So, you will not have a acid reflux. However, there are chances that there could be a bile reflux instead. Now, bile reflux is when your bile, the digestive liquid, which is essentially produced by the liver, is going to backflow into your esophagus. Okay, so how are you going to avoid a bile reflux? First of all, you need to sleep with your head which is elevated at 30 degrees. Okay, right after having or consuming any meal, do not go to sleep. You need to be awake for at least 30 to 60 minutes as well. Try to walk and try to sit upright as well. Maintaining a good posture is also extremely very important. Eat small meals throughout the day and ensure to chew your food well. Next, an important symptom of gastrectomy is post-gastrectomy is the dumping syndrome. What is meant by dumping syndrome? Dumping syndrome will occur when large amounts of food or undigested food are going to pass too quickly into the small intestine. So The symptoms of dumping syndrome can occur right after you eat a meal, and this is called as early dumping syndrome, or it can occur hours after eating a meal. This is called as the late dumping syndrome. Let us try and understand the distinction between these two. Early dumping syndrome will occur within 15 to 60 minutes when after consuming a meal, and it is generally triggered by eating or drinking large portions of food at once. So what happens, and it can also occur when you ingest foods or drinks which are high in sugar as well. So the common symptoms of early dumping can be bloating or loose motions or even feeling weak or nausea as well. Late dumping syndrome can occur 1 or 2 or more hours after eating a meal which is high in carbohydrates and high in sugar as well. Our body will actually absorb the carbohydrates or sugars, due to which what will happen is that the blood sugar levels tend to rise quickly. And when your blood sugar is going to rise quickly, our body is going to also produce insulin. Now, when the insulin is also released in more quantity, the blood sugar levels will fall below normal, and this can cause hypoglycemia, or what we call as low blood sugar levels. So, first of all, what are the symptoms of a late dumping syndrome? Sweating is there, drowsiness is there, you feel a lot of weakness, you're sensitive to heat, you can experience palpitations, or you can also have nausea, blurred vision as well. So, what are the tips to prevent or manage early and late dumping syndrome? First of all, you need to avoid foods or drinks which are having high sugars or added sugars as well. You need to eat small frequent meals throughout the day. Ensure that you are including one protein source along with your meals, either for lunch and dinner. You need to consume your fluids in between your meals and not with your meals as well. Ensure to chew your foods thoroughly and not to gulp it up. And you need to avoid snacks or meals which are going to be having lots of carbohydrates in well. And you need to always pair a carbohydrate along with a protein source, because it will also help in controlling the sugar levels, and it is also going to help in giving you a feeling of fullness as well. So, to conclude, diet after a post gastrectomy is extremely important. It is always important to ensure to have small frequent meals in the diet, and you need to also ensure that you drink fluids in between the meals. Thank you so much for watching my video, and we at ZenOnco.io are always here to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.